1. Introduction. Dr. Leslie Kernisan is a board-certified geriatrician and the founder of BetterHealthWhileAging.net. In this video, she delivers a message she believes every older adult and every family member needs to clearly understand. When an older person begins to show signs of memory loss or difficulty thinking, this is not a normal part of aging. It is a warning sign that deserves proper medical evaluation. Dr. Kernisan emphasizes that an initial assessment does not require a specialist and can be fully performed in a primary care setting by a family doctor or an internal medicine physician, as long as the patient and family know what to ask. The purpose of this video is to help viewers recognize the most common causes of cognitive decline in older adults and to understand the essential evaluation steps a physician should take. These steps are critical for identifying conditions that may be treatable, reversible, or significantly improved with timely care. 2. Two common misconceptions. There are two widespread misconceptions about memory loss and declining thinking ability in older adults. These misunderstandings exist not only in the general public, but even within the medical community. The first misconception is the belief that forgetfulness, short-term memory loss, or slower thinking are a normal part of aging. According to Dr. Kernisan, this assumption is simply wrong. While memory problems do become more common as people grow older, they are never normal. They are always a signal that something is affecting brain health and that the situation deserves careful medical evaluation. The second misconception is the idea that there is nothing to be done because memory decline cannot be treated, especially when people immediately think of Alzheimer's disease or other forms of dementia. In reality, although some neurodegenerative conditions cannot be fully cured, many other causes of cognitive decline are treatable or improvable. Even for individuals with Alzheimer's disease, identifying and addressing underlying medical issues can help them think more clearly and enjoy a better quality of life. Key takeaway shown. Memory decline is not normal aging. It is a medical warning sign that should never be ignored. Key takeaway 2. There is almost always something that can be done to improve or support brain function. A proper medical evaluation is essential and should never be skipped. 3. One essential principle to remember when evaluating memory loss and declining thinking in older adults is that this condition is rarely caused by a single factor. In real-world clinical practice, cognitive decline in older individuals is most often multifactorial, meaning several issues are affecting brain function at the same time. These contributing factors may include chronic medical conditions, medication side effects, metabolic imbalances, mental health disorders, or cumulative neurological damage that develops over many years. Each factor may play a partial role, but together they can significantly impair cognitive performance. For this reason, the goal of a medical evaluation is not to search for one definitive cause or a single diagnosis. Instead, it is to identify all the contributing factors that are undermining brain health. Once these factors are recognized, clinicians can intervene step by step by adjusting medications, treating coexisting medical problems, or correcting conditions that are potentially reversible. Even when a person is ultimately diagnosed with Alzheimer's disease or another neurodegenerative disorder, addressing these additional contributors can still help preserve thinking ability at the highest possible level and meaningfully improve overall quality of life. Part 1. 10 Common Causes of Memory. Decline 1.1. Medication side effects. Medication side effects are one of the most common and most frequently overlooked causes of memory loss and impaired thinking in older adults. Many medications used daily, including both prescription and over-the-counter drugs, can directly affect brain function, especially when older adults are taking multiple medications at the same time. Particularly concerning are drugs with anticholinergic effects, which interfere with the neurotransmitters essential for memory and clear thinking. This category includes sedating antihistamines, such as Benadryl, many cold and flu products or PM pain relievers, over-the-counter sleep aids, and certain medications used to treat overactive bladder. In addition, sedatives, sleeping pills, anti-anxiety medications, and some strong pain relievers can slow thinking, cause confusion, or worsen existing cognitive impairment. The critical issue is that many older adults and their families do not realize that these familiar, commonly used medications may be the root cause of memory problems. In many cases, simply reducing the dose, switching to safer alternatives, or discontinuing unnecessary medications leads to noticeable improvement in cognitive function. For this reason, a careful review of all medications is always a top priority when evaluating memory decline in older adults. 1.2. Metabolic imbalances. Metabolic imbalances are another major cause of memory loss and cognitive decline in older adults. This term refers to abnormalities in the chemical components of the blood, especially substances that play a critical role in normal brain function. In older individuals, the most common issues involve abnormal levels of sodium, calcium, and blood glucose. When these levels are either too high or too low, brain function can be significantly affected, leading to confusion, memory problems, slowed thinking, or noticeable behavioral changes. In addition, impaired kidney or liver function organs responsible for regulating and clearing substances from the body can allow toxins to accumulate in the bloodstream and negatively impact the brain. The key point is that metabolic imbalances are often relatively easy to detect through routine blood tests. When identified early and treated appropriately, cognitive function in older adults can improve substantially. For this reason, evaluating for metabolic disorders is always a critical component of any thorough assessment of memory decline. 1.3. Hormonal disorders. Hormonal disorders are an important yet often underestimated factor in the evaluation of memory loss and cognitive decline in older adults. In geriatric practice, the condition of greatest concern is hypothyroidism, or low thyroid hormone levels. The thyroid gland plays a central role in regulating metabolism throughout the body, including brain activity. When thyroid hormone levels are low, individuals may experience slowed thinking, forgetfulness, poor concentration, fatigue, and sometimes depression. In older adults, the symptoms of hypothyroidism are often atypical and easily mistaken for dementia or normal aging, which allows the condition to go undiagnosed. However, this is a cause of cognitive impairment that can be readily identified and effectively treated through simple blood tests and appropriate hormone replacement. Beyond the thyroid, imbalances in other hormones such as estrogen or testosterone can also influence brain function, although these issues are more common in middle-aged adults than in the very old. Nonetheless, when assessing memory decline, clinicians should always consider hormonal factors as part of the overall picture to ensure that potentially reversible causes are not overlooked. 1.4. Vitamin deficiencies. Vitamin deficiency is a common and potentially reversible cause of memory loss and cognitive decline in older adults. Among all vitamins, vitamin B12 is the most critical for normal brain and nervous system function. B12 deficiency is relatively common in older people due to reduced absorption, inadequate dietary intake, or side effects from certain medications. When B12 levels are low, individuals may develop symptoms such as forgetfulness, confusion, poor concentration, behavioral changes, or even sensory disturbances. In some cases, clinicians may also consider testing for folate or other B vitamins, particularly when an older adult has risk factors such as poor nutrition or gastrointestinal disease. Early detection and timely supplementation of these deficiencies can lead to meaningful improvements in cognitive function. Although many vitamins are essential for overall health, not all have strong evidence supporting a role in improving memory decline. For example, despite extensive research, vitamin D supplementation has not consistently shown clear benefits for cognitive improvement. Therefore, vitamin evaluation should focus on deficiencies with clear clinical relevance and solid scientific evidence, rather than indiscriminate supplementation. 1.5. Delirium. Delirium is a critically important and very common cause of memory loss and impaired thinking in older adults, especially in the setting of acute illness. Delirium is a sudden disturbance in brain function that causes a person to become more confused than usual, with reduced attention, disorganized thinking, or abnormal behavior. It typically occurs when the body is under significant stress, such as during hospitalization, surgery, infection, injury, or serious medical illness. In older adults, particularly those who are frail or have underlying health conditions, delirium can develop even when the triggering illness is relatively mild. Its presentation often closely resembles dementia or psychiatric disorders, leading to mistaken assumptions that the person has suddenly developed Alzheimer's or acute dementia. A key distinguishing feature, however, is that delirium has a rapid onset, and symptoms often fluctuate over the course of the day. Although delirium may improve once the underlying cause is treated, recovery in older adults is frequently prolonged, lasting weeks or longer. Some individuals may never return fully to their prior level of cognitive function. For this reason, when evaluating memory decline, clinicians must always consider whether the individual is currently experiencing or has recently experienced an episode of delirium. 1.6. Mental health disorders. Mental health disorders are another significant factor that can cause or worsen memory loss and cognitive decline in older adults. Among these, depression is the most common and the most frequently overlooked. Depression in later life does not always present as sadness. Instead, it often manifests as poor concentration, memory problems, slowed thinking, and loss of motivation, sometimes creating a clinical picture that closely resembles dementia, a phenomenon often referred to as depressive pseudodementia. Anxiety can also have a substantial impact on attention and memory, particularly when chronic anxiety disrupts sleep or keeps the individual in a constant state of psychological stress. In some older adults, depression may be accompanied by psychotic symptoms, such as delusions or distorted thinking, further intensifying cognitive impairment. In a smaller number of cases, older adults may live with severe psychiatric conditions, such as bipolar disorder or schizophrenia, which were typically diagnosed earlier in life. A careful review of psychiatric history and current symptoms is essential to distinguish primary mental health disorders from neurological disease. This distinction allows clinicians to pursue the most appropriate and effective treatment strategy. 1.7. Sleep disorders. Sleep disorders are another common yet frequently underestimated cause of memory loss and impaired thinking in older adults. Adequate, high-quality sleep is essential for brain function, particularly for attention, learning, and memory consolidation. When sleep is disrupted, cognitive performance often suffers, sometimes dramatically. One of the most important sleep-related conditions to consider is sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep. Sleep apnea is common in older adults and often goes undiagnosed. It leads to fragmented sleep and reduced oxygen delivery to the brain, which can result in daytime sleepiness, poor concentration, slowed thinking, and memory problems. Other sleep issues, such as chronic insomnia, frequent nighttime awakenings, restless legs syndrome, or disrupted sleep-wake cycles, can also impair cognitive function. In addition, medications used to treat sleep problems may themselves worsen confusion or memory, especially in older individuals. The critical point is that sleep disorders are often treatable. When sleep quality improves through behavioral strategies, treatment of underlying conditions, or appropriate medical interventions, cognitive function may also improve. For this reason, evaluating sleep should be a standard and essential part of any assessment of memory decline in older adults. 1.8. Brain cell damage from injury or vascular disease. Damage to brain cells caused by injury or vascular disease is a major contributor to memory loss and cognitive decline in older adults. The most common issues in this category involve cerebrovascular disease. The brain is highly dependent on a healthy blood supply to deliver oxygen and nutrients. When blood vessels are damaged, the surrounding brain cells are inevitably affected. Large vessel damage can result in a stroke, often accompanied by obvious symptoms such as weakness, speech difficulties, or loss of balance. However, in many older adults, the small blood vessels in the brain sustain gradual, silent damage over time due to conditions such as high blood pressure, diabetes, abnormal cholesterol levels, smoking, or chronic inflammation. This process, often referred to as small vessel disease, can accumulate slowly and lead to memory problems, slowed thinking, and reduced information processing speed. In addition to vascular injury, head trauma, even injuries that occurred many years earlier can have lasting effects on brain function. For this reason, a thorough cognitive evaluation must include a review of stroke history, cardiovascular risk factors, and any past head injuries to determine the role of brain damage in the individual's current cognitive condition. 1.9. Brain cell damage from neurodegenerative disease. Neurodegenerative diseases are among the most common causes of memory loss and cognitive decline as people reach older age, particularly in those who live into advanced years. This group of conditions is characterized by the gradual damage and death of nerve cells in the brain, a process that often unfolds silently over many years before clear symptoms become apparent. The most common neurodegenerative disorders include Alzheimer's disease, Parkinson's disease, Lewy body dementia, and frontotemporal degeneration. These conditions typically lead to progressive cognitive decline, beginning with mild cognitive impairment and eventually advancing to dementia, at which point individuals lose independence and require assistance with daily activities. Among them, Alzheimer's disease is the leading cause of dementia in older adults. Although neurodegenerative diseases are not currently curable, early diagnosis remains critically important. It allows individuals and families to plan appropriately for future care and enables clinicians to identify and treat coexisting medical issues that may worsen cognitive decline. Even as the disease progresses, careful management of contributing factors can help preserve quality of life at the highest possible level. 1.1. Infections. Infections are a less common but still important consideration when evaluating memory loss and cognitive decline in older adults. Certain acute or chronic infections can directly affect the brain, including bacterial, viral, parasitic, or fungal infections that cause encephalitis or other forms of neurological damage. In such cases, individuals usually exhibit clear systemic symptoms such as fever, profound fatigue, headache, or altered level of consciousness. In geriatric clinical practice, however, direct infection of the brain is not a routine cause of long-term memory decline. More commonly, older adults become confused in the setting of systemic infections such as pneumonia or urinary tract infections. In these situations, the cognitive change is typically classified as delirium, the brain's response to acute physical stress, rather than the result of infection within the brain tissue itself. For this reason, when memory decline appears suddenly or occurs alongside signs of infection, prompt medical evaluation and treatment of the underlying cause are essential. Timely management of infections can lead to significant improvement in cognitive function and helps prevent serious complications in older adults. Part 2, 10 Essential Steps Physicians Should Take When Evaluating Memory Decline 2.1. Acknowledge the patient's concerns. When evaluating memory loss or cognitive decline in older adults, the first and most fundamental step is for the physician to listen to and acknowledge the patient's own concerns. This is not always straightforward, as many older individuals may not recognize their memory problems, may deny them, avoid the topic, or feel uncomfortable when it is raised. For this reason, clinicians must approach the subject with sensitivity and use carefully chosen questions to encourage open and honest discussion. By taking the patient's perspective seriously, the physician gains insight into how aware the individual is of their current condition, which difficulties they notice most, and what worries or matters to them personally. This information is invaluable when compared with the clinician's own observations and with input from family members or caregivers. Just as importantly, this step helps establish trust between the physician and the patient, laying a strong foundation for accurate assessment, ongoing monitoring, and appropriate intervention in the steps that follow. 2.2. Gather information from family members or close contacts. In addition to listening to the patient, physicians must actively seek input from family members, caregivers, or others who have frequent contact with the older adult. The reason is straightforward. Once memory or thinking problems emerge, the patient is often no longer a fully reliable source of information about the severity or progression of their difficulties. Those close to the individual are usually better positioned to notice changes in daily functioning, behavior, personality, or the ability to manage routine tasks over time. Family input allows the physician to understand how cognitive decline manifests in the person's everyday environment, rather than relying solely on a brief clinical encounter. It also helps distinguish between mild, temporary changes and signs of a progressive decline. It is important to emphasize that family members sharing relevant observations with the physician does not violate medical confidentiality. It is a legitimate and essential part of proper medical assessment. Close collaboration among the patient, family, and healthcare professionals significantly improves the accuracy of diagnosis and the effectiveness of subsequent interventions. 2.3. Assess daily functioning and life management. A critical next step in evaluating memory decline is determining whether the older adult's ability to function in daily life has been affected. In geriatrics, this is known as a functional assessment, which focuses on two main domains: basic activities of daily living and more complex instrumental activities. Basic activities of daily living include fundamental skills such as walking, eating, bathing, dressing, and using the toilet. Instrumental activities of daily living, on the other hand, reflect the ability to live independently and include managing finances, taking medications correctly, cooking, shopping, driving, and using transportation. When memory and thinking begin to decline, these more complex activities are typically affected first. Physicians should ask patients directly about difficulties in daily functioning and then verify this information with family members or caregivers. Functional assessment not only helps guide diagnosis, such as distinguishing mild cognitive impairment from dementia, but also allows for early identification of safety risks and the level of support the individual may need to manage everyday life effectively. 2.4. Evaluate changes in behavior, mood, and thinking. After assessing daily functioning, physicians should proceed to evaluate changes in behavior, emotional state, and patterns of thinking. These changes frequently accompany cognitive decline and can provide critical clues about underlying causes. A thorough assessment should integrate the patient's own report with observations and feedback from family members or caregivers. Specifically, clinicians should explore symptoms such as depression, anxiety, apathy, personality changes, increased irritability, or loss of interest in previously enjoyed activities. Attention should also be paid to more concerning signs, including hallucinations, delusions, unfounded suspicion, or other unusual behaviors. Some individuals may experience spatial disorientation, become prone to getting lost, or have difficulty with visual perception and judging distances. These manifestations not only have a significant impact on quality of life, but also help clinicians determine whether cognitive decline is more likely related to a neurological disorder, a psychiatric condition, or another medical issue. Early identification of behavioral and emotional changes is essential for developing an appropriate care plan and providing effective support for both the patient and their family. 2.5. Evaluate new physical and neurological symptoms. In addition to changes in memory, behavior, and mood, physicians must pay close attention to any new physical or neurological symptoms that appear in older adults. Such symptoms may indicate that cognitive decline is linked to a specific medical condition, particularly neurological disorders or cerebrovascular disease. During the evaluation, clinicians should ask whether the individual has developed new difficulties with walking or balance, or experiences weakness, clumsiness, or loss of coordination in the arms or legs. Changes in speech, articulation, swallowing, or motor coordination are also important warning signs. In addition, symptoms such as dizziness, frequent falls, persistent headaches, or sudden changes in vision require careful assessment. Evaluating physical and neurological symptoms enables early detection of serious conditions such as stroke, brain injury, or progressive neurological disease. This information not only supports accurate identification of the causes of cognitive decline, but also helps determine the urgency and direction of medical intervention, ensuring the patient's overall safety and well-being. 2.6. Assess substance use and the risk of misuse or withdrawal. Another essential component in evaluating memory decline in older adults is assessing the use of substances that can affect brain function. Physicians should ask directly about alcohol consumption, tobacco use, recreational drugs, as well as prescription and over-the-counter medications, particularly sedatives, sleep aids, strong pain medications, and anti-anxiety drugs. In older adults, the brain is more sensitive to these substances. As a result, even amounts considered moderate can lead to confusion, memory impairment, or slowed thinking. Long-term use may also cause chronic brain damage, most notably with alcohol. Conversely, if an individual suddenly stops using alcohol or certain medications that have been taken regularly, they may experience withdrawal, which can also trigger confusion, agitation, and cognitive disturbances. For these reasons, an honest and comprehensive assessment of substance use, supplemented by input from family members when appropriate, is indispensable for identifying contributing factors and developing an effective, safe intervention plan for the patient. 2.7. Review all medications.